सो ये सेशन में जो है आई विल ट्राई टू क्वेंच द थर्स्ट ऑफ साइंटिफिक माइंड्स टू प्रूव कि यस जो ईएफटी जो है वो होक्स नहीं है, इट्स नॉट अ वुडू साइंस, इट्स एक्चुअली अ साइंस। और उसके साथ ही साथ आई वुड लाइक टू introduce everyone to a technique and take some 10 minutes extra for that to understand this technique, ताकि आज जो भी अटेंड कर रहे हैं वो ये खुद अपनी टेक्निक सीख के खुद के ऊपर एटलीस्ट प्रयोग करना शुरू कर सके। सो यू कैन स्टार्ट एक्सपेरिमेंटिंग विद दिस टेक्निक। तो ये मेरा आज का प्रयास रहेगा। और ईएफटी ये जो टेक्निक है वो बहुत बहुत इफेक्टिव टेक्निक है, जो मैं खुद ने एक्सपीरियंस किया है। इट्स एक्सपेरिमेंट करके, एक्सपीरियंशियल लर्निंग करके आई एम टेलिंग यू, आज मैं आपको बता रही हूँ। सो इट वर्क्स वेरी क्विकली, इट वर्क्स वेरी इजीली, सो लेट्स डाइव इनटू इट। पहले बात मैं पूछना चाहूंगी कि इमोशंस का मतलब क्या है? व्हाट आर इमोशंस?
वेरी नाइस। इमोशन, एनर्जी इन मोशन, है ना। जो हम कुछ करना चाहते हैं, एनर्जी, जो हम कुछ भी करते हैं, करना चाहते हैं, उसके पीछे का जो कैपेसिटी है, दैट्स एनर्जी। और बीइंग एक्यूपंक्चरिस्ट, मैं तो इमोशन पे भी काफ़ी काम करता हूँ। हम इमोशन से डायग्नोसिस करते हैं कि हाँ, किस ऑर्गन, अगर दो ऑर्गन का इन्वॉल्वमेंट आ रहा हो, जैसे सिंपल बात है कि अगर किसी को ब्रीदिंग इश्यूज हैं, तो वो ब्रीदिंग इश्यूज में लंग का इन्वॉल्वमेंट है कि हार्ट का इन्वॉल्वमेंट है ना, किसका इन्वॉल्वमेंट ज़्यादा है। तो नॉर्मली हम ट्रेडिशनल मेडिकल अप्रोच में हम केस हिस्ट्री लेते हैं और उसकी उसके बेसिस पर डिफरेंशिएट करने की कोशिश करते हैं। रिपोर्ट्स भी हेल्प करता है बहुत जगह पे। लेकिन जो इमोशन के थ्रू अप्रोच लेते हैं, वो इमोशंस को देखते हैं कि कौन सा निगेटिव इमोशन ज़्यादा हावी है लाइफ में। अकॉर्डिंगली वी आइडेंटिफाई द ऑर्गन एंड वी वर्क। तो एक्यूपंक्चर में तो मैं इस तरह से काम करता हूँ। यस, इमोशन इज द एनर्जी इन मोशन। हाँ।
सो यस, इमोशंस इज, जैसे डॉक्टर अंजन ने बताया दैट इमोशन इज एनर्जी इन मोशन, आई ऑल्सो फील दैट। अगर जस्ट टेक वन सिंपल एग्जाम्पल, व्हेन remember the time when you were feeling very very angry, what happens? You either feel really angry and there is so much build up inside you, in your chest, in your mind, in your brain, and sometimes you can slap someone if you are angry at someone. किसी को आपने चाटा भी लगाया होगा गुस्से में, या sometimes you might have thrown something which was in your hand, कोई फेंका होगा, दरवाजा तोड़ा होगा। So यहाँ पे क्या हो रहा है कि जो एनर्जी चल रही है आपके अंदर, यू आर गिविंग अ वे टू दैट एनर्जी थ्रू योर बॉडी, राइट? तो आप अपने एनर्जी इन मोशन, जो इमोशन है, उसको आप अपने बॉडी के थ्रू एक वे कर रहे हो। ऐसे आप कितने इमोशंस को नाम कर सकते हैं? हाउ मेनी इमोशंस यू थिंक देयर आर? So this is the emotional wheel. There are seven, you see in the center, there are seven major emotions and they are divided into so many of emotions. This is available freely on internet, ये easily freely available है internet पे। I would suggest कि ये आपके phone में रखिए, because कभी कभी क्या होता है, when we are feeling something, we are very disturbed and we don't know what it is. And when we go through this emotional wheel, we can exactly put in words. These words help us to understand what we are feeling at that moment. And when that clarity comes, at that time you can start working on it, or that gives you one level of satisfaction ki acha theek hai, I'm feeling helpless now. I'm not fearful, but actually it is helplessness. So why am I feeling helpless? So all these things will start coming. So this emotional wheel really helps to put your emotions into perspective. So these are so many emotions that a human being can feel. There's so many emotions, right? And these emotions, where do we feel these emotions? Like we just discussed, we feel it in our body, sometimes in every cell. You can say scientifically, no one has been able to prove कि कहाँ exactly emotion feel होता है. But of course, brain में एक area है जिसको हम limbic system के नाम से जान सकते हैं, जो अपना seat of emotions है, जो बहुत important role मैटर करता है, जिसका इमोशंस में कंट्रोल करने में भी, इमोशंस फील करने में भी, एक्सप्रेस करने में भी। सो ये लिम्बिक सिस्टम जो है वो ब्रेन में पता है, लेकिन हाउ डू वी फील इट इन आवर बॉडी? वी फील इट इन ईच एंड एवरी सेल, वी एक्सप्रेस इट थ्रू आवर बॉडी। हाउ डू वी एक्सप्रेस दीज इमोशंस? थ्रू वेरियस एक्शंस। जब हमें बहुत अच्छा लगता है तब हम हृदय पे हाथ रखते हैं। when we feel love towards somebody, we hug that person. when we are stressed, what we do? हम अपना सर खुजाते हैं, है ना? वी डू दिस कि क्या हो रहा है, ये क्या हो रहा है, अपना माथा पे हाथ लगाते हैं। जब भी हम सोचते हैं तो हम ऐसे मोस्टली ऐसे सोचते हैं, है ना। सो ये जो है वो सारा हम सबकॉन्शियसली अनकॉन्शियसली करते रहते हैं। सो ऑल दीज इमोशंस आर एक्सप्रेस्ड थ्रू आवर बॉडी वेरी वेरी सबकॉन्शियसली, वेरी वेरी unconsciously. So what I'm trying to say here is that there is mind and body connection for emotions. You're feeling your emotions and you're expressing it through your body. Human beings are capable, हम लोग जो है इंसान बहुत बहुत स्ट्रॉन्ग इमोशंस फील करने के लिए कर सकता है। दूसरा कि हम जो है ये इमोशंस अपने बॉडी थ्रू एक्सप्रेस करते हैं। और तीसरी बहुत इंपॉर्टेंट चीज जो है कि whenever something happens, what we do is we do self talk। हम खुद से बहुत बात करते हैं। Just remember anything which has troubled you or which has given you a lot of happiness recently, and when you are thinking about it later, you must have spoken to yourself about it कि ऐसे हुआ, ऐसे हुआ, ऐसे हुआ। And if you observe your thoughts, you will realize कि most of the thoughts are repetitive and most of the thoughts are negative about yourself। कि मैंने ऐसा क्यों किया, why did I do this? Maybe I would have said something, different to that person. That person would have not felt bad. Did he feel bad? Did I make him feel bad? So all these things we do a lot of self talk related to our emotions. So ये जो है ये बेसिस है, आप एक तरह से बेसिस समझ सकते हो ईएफटी का, इमोशनल फ्रीडम टेक्निक का। मुझे हिस्ट्री बहुत पसंद आती है, कोई भी चीज जो नहीं आती है उसकी हिस्ट्री बहुत पसंद आती है। सो लेट्स टॉक हाउ इट स्टार्टेड। So in medical language, there are some cases which are, uh, in statistically and medically, we say them they are outliers, meaning that they do not fit into a particular set criteria of a disease or the progression, or how a patient should respond to particular treatment. They're outliers, and we say that they're outliers, and usually clinicians don't pay attention to them. But I believe, and I strongly believe, that these are the cases which teach us most, because there is something in those patients, there's something in those people that is helping them, either helping them or not helping them. And to learn that will give us more broader perspective of whatever we are trying to achieve. So the same thing happened with Dr. Roger Callahan, who was a clinical psychologist. He's no more now. He was also expert in Oriental medicine, Chinese medicine, acupressure, acupuncture. He was expert and he was practicing the energy systems. He had a case, and he was working with the patient for a few weeks. She had water phobia. उनको पानी से डर लगता, कि पानी का ग्लास हाथ में लेने से भी डर लगता था। And one day while the session was going on, he just asked her to tap on certain points on her abdomen. Tap करने के लिए बोला, tap करने के लिए बोला। And within few minutes, while she was focusing on her problem and tapping, she realized that she no more fears water. उनका जो phobia है वो चला गया। And that is what intrigued Dr. Roger Callahan. So what he did is he tried to learn and search more about it, and he developed a technique called thought field therapy. So thought field therapy is sort of a father of EFT, because when Gary Craig, who was very interested in personal development, went to learn this technique, TFT, to Dr. Callahan, he realized that there are a lot of intricacies. It's very, very deep knowledge is required to practice TFT. Specific points निकालने पड़ेंगे बॉडी में अगर इसके ऊपर काम करना है पेशेंट के साथ. So you need to be expert in practicing TFT. And he wanted, गैरी क्रेग जो है वो चाहते थे कि ये सभी लोग यूज कर सके. Everybody should be, it should be accessible to everybody. So he what he did is he made the process very easy, and that is what we learn today. We talk today about EFT. और EFT में भी आज हम बात करें क्लिनिकल EFT. सो व्हाट इज क्लिनिकल EFT? क्लिनिकल EFT जो स्टेप्स है EFT का, द स्टेप्स इफ दे आर फॉलोड इन पर्टिकुलर वे विच आर sort of standardized by Gary Craig and also Dawson Church, and they have written manuals about it. And if that method is practiced, that method is called as clinical EFT. And the studies we will talk today about are also ओनली ऑन क्लिनिकल EFT, क्योंकि कोई भी एक प्रोसीजर आ जाती है, टेक्निक आ जाती है, उसमें थोड़े थोड़े वेरिएशंस होना स्वाभाविक है. अपने अपने एक्सपर्टीज के हिसाब से पीपल मेक वेरिएशंस। तो आज हम बात करेंगे क्लिनिकल ईएफटी के बारे में। सो ये हमने हिस्ट्री भी पढ़ ली। अभी पावर क्या है ईएफटी का, ये हम कुछ पढ़ने जा रहे हैं। इज इट इवन वर्थ लर्निंग? सो इट इज एविडेंस बेस्ड प्रैक्टिस। तो डॉक्टर्स को तो पता है व्हाट इज एविडेंस बेस्ड प्रैक्टिस। जो नहीं जानते हैं, फॉर देम एविडेंस बेस्ड प्रैक्टिस कोई भी टेक्निक को नाम देने के लिए देर आर सम क्राइटेरियाज। वो क्राइटेरियाज को बहुत कीनली, बहुत डीपली फॉलो करना पड़ता है, जिसमें पता चलता है कि टेक्निक है, इफेक्टिव है, वो बहुत उसके ऊपर रिसर्च किया गया है, बार बार कंसिस्टेंटली वो सेम रिजल्ट्स दे रही है, और करंट जो टेक्निक्स अवेलेबल है उससे ज्यादा या उससे बराबर का इफेक्ट वो टेक्निक से मिलता है। सो उसको हम एविडेंस बेस्ड प्रैक्टिस कहते हैं। सो दिस प्रैक्टिस इज एविडेंस बेस्ड प्रैक्टिस। इट इज सेफ, इट इज इफेक्टिव, इट इज लॉन्ग लास्टिंग, लंबे समय तक रिजल्ट देती है। ऑल्सो साइमल्टेनियसली अगर कोई बंदा इसको एंगर के लिए यूटिलाइज कर रहा है, तो एंगर के साथ साथ एंगर का जो उसका रीजन है, शायद स्ट्रेस हो सकता है, एंजाइटी हो सकता है, सो वो भी कम हो जाता है। सो उसको हम मेडिकल लैंग्वेज में कहेंगे साइमल्टेनियस सिम्टम्स का रिडक्शन हो जाता है, साइमल्टेनियस सिम्टम्स रिडक्शन। सो टिल डेट clinical EFT पे there are 56 RCTs and 8 meta-analyses done, which follows uniform clinical EFT method. So which is a significant number. There can be still more studies done, and there need to be more studies done, of course. But 56 RCTs, which are published in international journals, is a very good number to really believe in the technique. Now let's talk. There are bodies, medical bodies, जो टेक्निक को एक्सेप्ट करते हैं या एक्सेप्ट नहीं करते हैं. सो EFT is accepted by American Psychological Association, American Medical Association, Nursing Association, and also Canadian Psychotherapy Association. नाइस गाइडलाइंस जो है यूके के जो है, द नाइस गाइडलाइंस डू नॉट एक्सेप्ट इट एट दिस पॉइंट एज अ गाइडलाइंस for treating any psychosomatic disorders, because when it was put to NICE that okay, EFT is a technique which is very very useful, you can consider it for guidelines. The research at that time on EFT was mostly on veterans. So experts from NICE suggested that veterans is okay, but we would like to see the effects in general population. So now, though the studies have come up, NICE is under consideration of, they are into the process of evaluating to consider it as a guideline or not. Evidence-based practice, it is an evidence-based practice, was first time. This is a very important paper from 2013 by Dawson Church. Dawson Church is also an author for a book called Mind to Matter, Gene in Your Genes. So he is a very thorough researcher. And this was the first, I would say, important paper which proved that EFT is an evidence-based practice. EFT has been worked a lot in PTSD patients, and this is what this paper also suggests. Just give me a minute.
माइंड टू मैटर और ब्लिस ब्रेन, अभी दो बुक की बात आई। यह दोनों बुक जो है ये बहुत अच्छी है, और मैं समझता हूँ कि हर एक हेल्थ प्रोफेशनल को माइंड टू मैटर और ब्लिस ब्रेन ये दोनों बुक पढ़नी ही चाहिए। स्पिरिचुअल डॉक्टर्स फॉर होलिस्टिक हेल्थ के द्वारा ये दोनों रिकमेंडेड बुक्स है फॉर हेल्थ प्रोफेशनल। एक कॉमन मैन भी पढ़ना चाहे तो पढ़ सकता है।
Yeah. So coming back, these are the guidelines for treatment of PTSD. This is also one of the important paper I would suggest, because you can read the red lines, the underlines. So basically, it tells us that EFT is effective within 4 to 10 sessions. 4 से 10 सेशन में इफेक्टिव हो सकती है. ग्रुप थेरेपी भी दी जा सकती है. कोमोर्बिड कंडीशंस जैसे साइमल्टेनियस सिम्टम रिडक्शन की बात की, इट टॉक्स अबाउट दैट. Their adverse reactions are, adverse effects are very very low, and this treatment produces physiological as well as psychological improvement. आपका physiology भी improve होगा, आपका mentality भी improve होगा. Patient gains persist over time. जो gains होते हैं वो long term तक effective रहते हैं, cost effective है, क्योंकि आपको pocket से कुछ नहीं खर्च करना है. What you have to do is just utilize your mind, utilize your body, and just use it. There is, if you learn it once, it is very cost effective. Biomarkers जो होते हैं बॉडी में, like stress hormones and genes, are also regulated through this technique, and this technique can also be adopted for remote utilization. So this paper talks in detail about it. Also, it gives detailed guidelines for treating PTSD, when it can be used, when it cannot be used, when it needs to be used with pharmacotherapy, because pharmacotherapy का जो अपना एक role है, that definitely stands. It is required in severe cases. When it's required, it is definitely required. So this paper talks about everything about guidelines of PTSD. Let's learn that, what is the science behind it. Now let's get into the subject. So like we discussed before, that it is mind body medicine, and along with that there is a additional portion of Chinese medicine, oriental medicine, of acupoints. So jo science hai, it is in the technique. So technique has two components. First component is a setup statement. एक जो चीज आप बात करोगे, एक स्टेटमेंट आप बनाओगे, वो एक पार्ट है. And another part which will simultaneously go is tapping. जैसे आप स्टेटमेंट बोलोगे, उसके साथ साथ आप टैपिंग भी करोगे. तो the statement helps us to tune into our body, in our sensations, in our emotion. And tapping, it is proven that the tapping activates, deactivates, or disconnects various regions in the brain. So this is the basic science behind it, how it affects our physiology. So if you want me to put my understanding in one word, it is psycho, neuro, physio, immuno, endocrinology. This word is the most important word in understanding physiological effects of EFT. What does it mean? Is psycho is our thoughts. जो हम सोचते हैं वो है psycho. Our thoughts affect our neurons, our neurology. Our neurology controls our physiology, also our hormones and our immunity. So basically, thoughts, neuro, अपना brain, then our body, then our immunity, जो रोग प्रतिकारक शक्ति है वो, और अपने body के hormones. So EFT affects all these components. Though there are more studies in psychological aspect of EFT, physiological aspects of EFT has been recently been studied since, you can say, 1890. There are very less papers. So I always say that the additional therapies which are there, they are effective, but they are not evidence based, because it is not researched in that extent, to that extent. So they are definitely very, very effective, but there is a lack of evidence because it's not researched enough. So there's a lot of physiological effects are now being studied. So what are the physiological effects? Because of tapping, the acupoints are activated and they cause changes in brainwave activity to specific brain regions. जैसे हमने पढ़ा कि लिम्बिक सिस्टम जो है अपना इमोशन पे बहुत इंपॉर्टेंट है. सो दिस टेक्निक रेगुलेट्स आवर लिम्बिक सिस्टम, मेमोरी पाथवेज. We will see that, we are actually changing our brain. We are using neuroplasticity also in these statements when we are using the setup statement. So this neuroplasticity creates newer pathways in our brain, making cognitive reforms. One study was done that how EFT is effective to manage pain, and they found that it actually decreases the connectivity between pain pathways and pain modulating areas. It helps to decrease that, and because the pain modulating areas are the connectivity is decreased, the pain intensity is also perceived as reduced. There is reduction in stress response. There are studies which have been done to find out cortisol level. So cortisol, ये जो hormone है, वो अपने stress से related होता है. So after EFT, they have found that there is significant difference in level of cortisol. So that means the stress has been reduced. लेकिन ये cortisol जो है, वो सिर्फ अपना stress नहीं reduce करता है. It has effect on our muscle mass. It increases our muscle mass. It has anabolic effect, right? Increase in bone density. It improves our cognitive function. अपना attention जो है, अपनी learning ability जो है, वो बढ़ती है cortisol कम होने से. The increase in cell signaling. Also, it is also found that reduction in cortisol improves skin elasticity and skin. So basically good for your aesthetics as well. So along with that, stress reduction होता है. उसके साथ साथ there is definitely a positive effect on your heart rate and blood pressure. So ये जो meridian points जो है जिस पे हम tap करते हैं, these are called meridian points. These points, they have found that these meridians which are used in Chinese medicine have a least resistance to electrical resistance, least होता है. So basically conductivity ज़्यादा होती है वहाँ पे. So because of increase in electrical conductivity of the skin where we are tapping, it can potentially also affect affect our bioelectrical system and improve our homeostasis in the body. This is one of the papers. This was published in 2019. And this talks about, this is a very, very interesting paper, because what they have done is they have studied 4 systems in our body. They have studied central nervous system, ANS, where they studied heart rate variability and heart coherence. They studied our circulatory cardiovascular system, जिसमें उन्होंने resting heart rate पढ़ा और ब्लड प्रेशर की पढ़ाई की कि हाउ ब्लड प्रेशर इज अफेक्टेड. They studied endocrine system with the cortisol measurement, and they studied immune system by help of salivary immunoglobulin A. तो अपने जो सलाइवा है उसमें कुछ इम्यूनोग्लोबुलिन ए नाम का एक सब्सटेंस जो है वो इम्यूनिटी से बहुत रिलेटेड है, उसको पढ़ाई किया. सो दे हैव स्टडीड 4 systems in this paper, and it's a very interesting paper which says basically that there is significant difference, positive difference in resting heart rate, blood pressure, cortisol, and immunoglobulin A. They had less number of uh, participants for heart rate variability and heart coherence. So though there was a difference, it was not significantly enough, and they needed to have more sample size. So if someone wants to do the research, yeah, this is the gray area still and can be worked upon. But yes, they found the difference. It was not significant for heart rate variability and heart coherence. This is a very good paper. If someone wants to go through it, it's a beautiful paper. What are the clinical uses? So of course, it's more used when EFT started to be used for population, general public. It was more used in veterans. So many studies are there in veterans, and that's why it's more of psychological problems, anxiety, phobia, PTSD, depression. PTSD पे तो बहुत पढ़ाई किया है, इसमें बहुत useful है. Physiologically, pain, autoimmune disorders, professional sports performance के लिए use किया जा सकता है. If you ask me, I think EFT can be used in anything and everything which makes you feel different than what you are. You know, as human beings, our innate nature is love. And whenever we deviate from this, we feel restless, we feel not ourselves. And मैंने तो इसको day to day life में बहुत use किया है. If I have had an argument with my husband, I have used it. If I have lost an argument with someone, I have used it. If I have started an argument, I have used it. If I had self-doubt, I have used it. So there are just n number of day-to-day life uses. I think we have Dr. Girdhar also with us, who is a psychiatrist, very well known in, I think from Delhi, who uses this practice in day-to-day in his clinic. And I hope we have some time to also listen to his clinical experience if that's permitted, and that's something we can look forward to. मुझे लगता है कि अगर if we make this system available, EFT, if this technique, if we make it available for people, patients, clients who come to our OPDs and who are just waiting, I believe that, you know, there is a lot of stress which happens in patients because they have been waiting outside for meeting a doctor, and the waiting period is so long. Along with that, of course, whenever there is a diagnosis of a disease made, it affects not just patient but also the extended family, the near and dear ones. Chronic diseases definitely takes a toll on whole family. So if this is made available to them, you know, it's a very effective tool. It will make them independent. Maybe the emergency calls which doctors get, that doctor ye ho raha hai, doctor I'm feeling this, is it okay, that might also be reduced. And being a doctor, understanding a condition, clinical condition, we can always explain red flag signs to our patients, so they know that, you know, this can be taken care by EFT, but now this is happening, I have to give a call. But definitely I believe 100% that it will increase the receptivity of patients during consultation. So आप जो बोलोगे doctor as a doctor आप जो भी advice करोगे, that will be understood and received in a better way by patients. Caregiver burden reduction, of course, empowering patients, and it will reduce cost and human suffering in large. So let's talk about setup statement. So setup statement has 2 parts in it. First part acknowledges what condition you are in. What is the current situation you are in? Emotionally, physically, both ways. And second part of this statement, which talks about complete acceptance of yourself. अगर आपने किसी ने लुई से की मिरर वर्क बुक पढ़ी होगी या उसके वर्कशीट के थ्रू काम किया होगा, तो उनका भी यही कहना है कि हमें कंप्लीटली एक्सेप्ट करना है, अपने आप को स्वीकार करना है और अपने आप पे प्रेम करना है. तो दिस मेक्स द सेकेंड पार्ट ऑफ द स्टेटमेंट. सो फर्स्ट पार्ट, फॉर एग्जाम्पल, even though I have this problem, so what am I doing is I'm acknowledging that this is the situation I am in. I completely and totally love and accept myself. हमें गुस्सा चिड़चिड़ इसलिए आती है क्योंकि हम अपने आप को वो स्थिति में देख नहीं पाते. वी आर अवे फ्रॉम व्हाट वी शुड बी, व्हाट वी आर, व्हाट वी एक्चुअली आर. तो वो स्थिति में हम एक्सेप्ट ना करने के कारण हमें चिड़चिड़ होती है. तो दिस सेकंड स्टेटमेंट हेल्प्स इन कॉग्निटिव रिफॉर्मिंग. तो पहला जो है, इट्स अ पार्ट ऑफ एक्सपोजर टेक्निक, विच बेसिकली एक्सपोजर टेक्निक सिंपल लैंग्वेज में बताना है तो अगर स्विमिंग पूल में आपको कूदी मारनी है लेकिन आपको ऊंचाई से डर लगता है, तो आप क्या करोगे? पहले एज ऑफ द स्विमिंग पूल से करोगे, फिर धीरे धीरे ऊंचाई बढ़ाओगे और एकदम ऊपर वाले से कूदोगे. तो धीरे धीरे यू आर एक्सपोजिंग योर सेल्फ ग्रेजुअली, स्टेप लैडर. इसमें यू आर एक्सपोजिंग योर सेल्फ ऑन अ प्रॉब्लम विच यू आर फेसिंग करंटली. दैट्स अ पार्ट ऑफ एक्सपोजर टेक्निक. And the second statement helps us to cognitively reframe our brain. We are modifying the dysfunctional condition of the brain, and we are helping our emotions to be taken in a different and a positive way. We are responding to emotions instead of reacting to it by accepting ourselves. So this is a setup statement. This statement will be utilized at the same time you're tapping on certain points. So here you can see there are 9 points. The first point is this one. Then we'll go through all the points when we actually do it. And these are called meridian points or acupoints. Like I said, the electrical resistance is very, very low. So the tapping or stimulation of these points will easily affect the particular regions in the brain. So now you will say that, okay, fine, the setup statement has exposure technique and cognitive reframing, both is there. Then why tapping is needed? Because you're already tricking your brain into, believing something. Is tapping actually needed? Is it actually an active ingredient or just inert ingredient? So to answer this question, Fox and जो नीचे मैंने लिखा है, that is 2013 में उन्होंने they did a study. They tried to utilize it in a 20 undergraduate student. It was a randomized control trial, and they found that tapping does make significantly difference. This study is easily available online. Whoever is interested can go through that. So tapping is an active ingredient. It's an important ingredient of this technique, which the setup statement and tapping will go hand in hand, will go together. So if you have a pen and paper and there is some problem or there is something which you would like to work on, we can do that now, because I would really like to take 10 minutes to go through all the steps, and I hope this will help you to experiment or by yourself later on as well. So अभी अगर आपके पास पेन एंड पेपर है तो आप उसे ले लीजिए, और आप किसी के ऊपर भी काम करना चाहते हो तो आप उसे उसको लिख लीजिए. Here one thing is very, very important, to be true to yourself, because first statement is accepting what you're feeling now, right? So यहाँ पे हमें किसी को prove नहीं करना है. We are not answerable to anybody here. This is for yourself. So ensure that you truly tune into your body, your emotion. So if you're doing it suppose for example, simple anger, you say that I am feeling angry, and try and think that where this anger is felt in your body. Are you feeling it in your tummy? आपके पेट में हो रहा है, हार्ट में हो रहा है, शोल्डर्स में हो रहा है, सर पे हो रहा है, कहाँ हो रहा है? So you are connecting your emotion, be true to yourself. Wherever it is, try to tune in. And that's what will make your setup statement. ये कुछ भी हो सकता है. अगर आपके ऊपर किसी कुत्ते ने भौंक दिया और आपको डर लगा है, तो आप उसके ऊपर भी काम कर सकते हो. कभी कभी क्या होता है, ऐसा गली का कुत्ता भौंक देता है एंड देन वी ट्राई एंड अवॉइड गोइंग टू दैट गली ऑल टुगेदर. हम जाते ही नहीं है वो रास्ते पे. तो उसके लिए भी आप ट्राई कर सकते हो, बिकॉज दिस इज जस्ट अ ट्रायल. यू कैन डू दैट. सो नाउ इफ वी आर सेटिंग अप अ स्टेटमेंट, let's set it up in English, that even though I have this anger or I have this issue and I feel it in my body here. I totally and completely love and accept myself. ये हो गया सेटअप स्टेटमेंट. दिस इज अ सेटअप स्टेटमेंट. यू कैन राइट इट डाउन. हिंदी में अगर आप इसे कहना चाहेंगे तो मुझे बहुत गुस्सा है, मुझे अभी बहुत गुस्सा आ रहा है, या मैं बहुत गुस्सा महसूस कर रही हूँ और ये गुस्सा मुझे मेरे सर में महसूस हो रहा है. फिर भी मैं अपने आप को पूरी तरह से स्वीकार करती हूँ और अपने आप को पूरी तरह से प्यार करती हूँ. नेक्स्ट चीज आपको ये करनी है कि इसका इंटेंसिटी नोट करना है. 0 मतलब आपको कोई प्रॉब्लम नहीं है, 10 मतलब आपको बहुत ज्यादा प्रॉब्लम है. नोट द इंटेंसिटी, 0 being nothing and 10 being maximum. And now we'll start tapping. So the first point, ये मेरी लिटिल फिंगर है, ये वाले साइड पे है. I usually use 3 fingers to tap. You can choose to use 4 to whichever is comfortable for you. ये साइड में आपको टैप करना है, कंटिन्यूअसली टैप करना है. एट द सेम टाइम आपका जो सेटअप स्टेटमेंट है आप उसे बोलना है. जो द सेटअप स्टेटमेंट यू कैन आइदर से इट अलाउड or you can just keep it in your mind and say it again and again. I prefer to say it aloud because it sort of helps me to concentrate more, to be present more. Sometimes mind just wanders while you're tapping because it can become mechanical. So be very aware that the process does not become mechanical. You're always mindful of what you're doing and you're tuned in to your body and what is happening with you. So while you're doing, I prefer to say it 3 to 5 times at one point. So this is one point. Start doing, even if I have this problem. I truly and completely love and accept myself. अभी दूसरे हाथ में, अगर आपने राइट से शुरू किया है तो लेफ्ट में. इफ यू स्टार्टेड विथ लेफ्ट, टेक इट टू राइट and tap with your other hand. So this is the first point. It doesn't have to be, the taps doesn't have to be very hard. It can be very gentle. Just tap. You can keep your eyes open. You can keep your eyes closed. And repeat the statement that even though I have this problem or I feel this problem, I truly and completely love and accept myself. Now we'll go to the second point. ये अपनी eyebrows जो है, it's above the eyebrows, start of the eyebrows. You can do both. You can tap on both eyebrows simultaneously. And repeat the statement. Even though I have this problem, I truly and completely love and accept myself. Now we'll go to the third point, which is on side of the eyes. You can tap bilaterally at the same time. And repeat the statement. See how you're feeling. Even though I have this feeling, I truly and completely love and accept myself. Now we'll go to the fourth point, which is below your eyes. Yeah, let's start tapping. मैं अभी ये महसूस कर रही हूँ, फिर भी मैं अपने आप का पूरी तरह से स्वीकार करती हूँ और अपने आप को पूरी तरह से प्यार करती हूँ. Let's go to the fifth point, which is below your nostril, below your nose, above your upper lip. Keep tapping. Even though I am feeling this way, I truly and completely love and accept myself. I truly and completely love and accept myself. We'll go to the sixth point.
I have stopped the PPT for better visibility.
Okay, sure.
एंड लैपटॉप के फ्लैप को थोड़ा सा पीछे करें.
Yeah. Okay. So sixth point is over the chin. Okay. Even though I have this feeling, I truly and completely love and accept myself. मैं अपने आप का पूरी तरह से स्वीकार करती हूँ और अपने आप से पूरी तरह से प्यार करती हूँ. Now let's go to the seventh point. यहाँ पे अपना कॉलर बोन है. सो कॉलर बोन के स्टार्ट में आप क्रॉस भी कर सकते हैं हाथों को या स्ट्रेट भी रख सकते हैं जैसे आपको कंफर्टेबल हो. And we'll start tapping. मैं ये महसूस कर रही हूँ और मुझे शरीर में वो यहाँ पे महसूस हो रहा है. फिर भी मैं अपने आप का पूरी तरह से स्वीकार करती हूँ और अपने आप से पूरी तरह से प्यार करती हूँ. I accept and love myself.
I accept and love myself.
Now the eighth point, which is in the mid axillary line at the nipple level. तो अपने एक्सिला में यहाँ पे आप टैप कर सकते हैं. दोनों साथ में भी कर सकते हैं अगर चाहिए तो, या एक एक भी कर सकते हैं. जैसे आपको, आप जल्दी में है तो कर लो दोनों फटाफट फटाफट साथ ही में.
I would I would
पता नहीं.
recommend I would recommend कि एक बार में एक तरफ का ही करें तो
एक,
प्रॉपर होगा.
yes. So even though I have this feeling, I totally and completely love and accept myself. एक
And
साइड का हो गया.
this is the most important for most people. यहाँ पर दोस्तों हर एक EFT पॉइंट के पीछे जो एक्यूप्रेशर पॉइंट है या एक्यूपंक्चर पॉइंट है उसका एक स्पेसिफिक नाम है. एंड एवरी पॉइंट हैज लॉट्स ऑफ डिटेल. हर एक पॉइंट पे 1 घंटे का लेक्चर लिया जा सकता है. यह पॉइंट किस मेरिडियन से आता है, किस मेरिडियन पे यह किस तरह का पॉइंट है, या किस इमोशन से जुड़ा है, और हम इस किस इमोशन के डिस्टर्ब होने से कौन से हमारे डिजीज कौन होते हैं, कौन कौन से ऑर्गन इफेक्ट होते हैं. हर एक मेरिडियन की एक एनर्जी टाइमिंग भी होती है. जैसे हम ब्रीद करते हैं तो अपने लेफ्ट नॉस्ट्रिल से, कभी हम लेफ्ट नॉस्ट्रिल से करते हैं, कभी हम राइट नॉस्ट्रिल से करते हैं. एनर्जी लेवल पे हमारा हर एक ऑर्गन, हमारा हर एक मेरिडियन भी ब्रीद करता है थ्रू स्पेसिफिक पॉइंट्स, होररी पॉइंट्स. सो एवरी पॉइंट हैज लॉट्स एंड लॉट्स ऑफ डिटेल्स.
Yes, it's very true. So now we'll go to the last point, which is on top of our head. Yeah, you
जीवी
can either,
जीवी 20 अध्यात्म इसे बोलते हैं ब्रह्मरंध्र.
yes. So दोनों हाथों से या एक हाथ से जैसे कंफर्टेबल है. Just tune into your body and emotion. Even though I have this problem, I have this feeling, I truly and completely love and accept myself. मुझे ये दिक्कत है, फिर भी मैं अपने आप को पूरी तरह से स्वीकार करता हूँ और अपने आप से बहुत प्यार करता हूँ.
Here I would like to add one point, Dr. Maitreyi. There is Dr. Bradley Nelson. He
Hmm.
he uses whole tapping of whole GV meridian going through from the third eye, which is GV 24.5 to
Hmm.
GV 20, and even going back to the
जी
near about medulla region.
जी.
So one can do that as well.
यस, आज हम क्लिनिकल ईएफटी की बात कर रहे हैं तो क्लिनिकल ईएफटी का मेथड ये होने के कारण विल स्टिक टू दैट.
Okay.
सो अभी हमने सारे 9 पॉइंट्स पे कर लिया है. यहाँ पे इफ समवन वांट्स टू डू the first point again, can do it. Otherwise, now is the time to, now your body system has, your limbic system is deactivated. You can use your brains more. You can use your frontal cortex more now. So now just observe how you're feeling. Tune into your primary statement which you had made now, and now tune into again in your body and mind, emotion, how you're feeling. Note that intensity again. If the intensity is reduced, that means, okay, it is working fine. If you feel like you need to do a second round, you can do it again, second round. If intensity is increased, then what? Is it not working? It is still working. Why? Because we are surrounded by so many distractions that we hardly pay attention to our body and mind. And when you start doing EFT, what happens is you start tuning into yourself. And sometimes that can actually bring out more intense emotions, more intense physical reactions, responses to that. And that's okay. Just acknowledge that at that time. And again do the second time. Again do the third time. जब मैंने शुरू किया था, when I started, I would do it 3 times a day for 20 minutes each time. Consistency is very important. Anything you give a new try, consistency, doing it regularly. And of course, if your need is that much, you will put into that much efforts. If we can, ensure that we are taking tablets every day, we can ensure that we are giving 10 minutes for ourselves doing something which we really want to work on. So अगर intensity बढ़ भी रही है तो आप चिंता मत कीजिए. जो second part of the statement है, I completely and totally love and accept myself. How many people can say it with absolute conviction? कितने लोग कह सकते हैं ये, या कितने लोग नहीं कह सकते हैं, या ये कहने में हम कह तो रहे हैं लेकिन पूरे मन से नहीं हो रहा है ना? नहीं हो रहा है. क्यों नहीं हो रहा है? क्या नहीं हो रहा है? तो ये वापस और एक सर्किट शुरू हो सकता है. सो जो भी है, कभी कभी इट इज वेरी डिफिकल्ट टू रैडिकली एक्सेप्ट एंड लव आवरसेल्व्स. वी आर वेरी वेरी judgmental beings. We judge ourselves and we judge others also. So it can be very difficult. And this is a very practical problem which can be faced while you're practicing sometimes, at certain times. So उस समय पे क्या करना है आपको? If you're not able to accept or say this statement as it is, by believing in the process ऐसा है, इस पे मैं पूरी तरह से भरोसा करती हूँ तो मैं बोलने ही वाली हूँ. So either you believe it in the process and just say. If that is not possible, you can just say that I am in the process of accepting and loving myself. Or you can acknowledge ki I am not able to love and accept myself, but I would like to do that, because that's what we are looking for. So अगर आप कह सकते हैं कि मैं कोशिश में हूं कि मैं खुद को पूरी तरह से स्वीकार करूं, खुद से मैं पूरी तरह से प्यार करूं. So even if you can't say it, that's all right. You can modify it the way you feel it's right and then say it accordingly. मेरा ये एक्सपीरियंस है कि whenever we start doing, one cycle is over, the more you are tuned into your body and mind, the more early results you will get. And once the cycle is over, or in between the cycle while you're doing, the new informations will start popping in. Like you will realize, oh, okay, I'm angry, but why am I angry? Oh, something, irritated me. So am I angry or am I irritated? Okay, if I am irritated, then why is it that something what someone else did irritated me? So, you will start tuning into your body, mind, more and more, more and more, and the more insights will start coming up. Because your limbic system, which is the emotional side of your brain, is deactivated. It's calmed down now. Your more rational mind, your frontal cortex will start acting and you can analyze the situation. आप ऑब्जर्व कीजिए खुद को कि जब आप बहुत गुस्से में होते हो तब बहुत इरेशनल चीजें कर देते हो, कुछ भी कर देते हो, उसका कोई मतलब नहीं होता है. लेकिन जब आप ये करोगे तो यू विल स्टार्ट ट्यूनिंग इन एंड इट विल बिकम मोर एंड मोर इजी, मोर एंड मोर इनसाइट्स विल स्टार्ट कमिंग इन. So this is the technique. I hope अगर कुछ सवाल है तो हम बाद में भी डिस्कस कर सकते हैं, समय परमिट करे तो. Online I'll give you references, you can go through that. What are the advances if we talk just briefly on this? So the another variation of clinical EFT is gamut method. Gamut method में क्या होता है कि there are other points which are tapped after the clinical EFT is done, and also various eye movements, humming, saying certain numbers are utilized in gamut method. So my understanding of it is that it basically helps us to reach to the deeper levels of our subconscious, which we're not even aware about. And it has been effective when I have given it a try. Remote EFT, it means that you are actually proxying for somebody else and doing EFT for somebody else. Please do not try any of this without a proper training. Inner tapping, meaning in our past, something has happened and we are not able to get over it, or we want to work on it. You can consider, it can be in your childhood as well. So you consider yourself in that situation, feel what you were feeling, give a name to that emotion, try and find out where it was in your body at that time. And now, when you face those triggers of trauma, where do you feel it in your body? And make a setup statement. So you're basically working on your inner child through EFT. Now, that is what is inner tapping. And future tapping is, जैसे you know that there is going to be a situation where you're going to be anxious, or you will feel something which you wouldn't want to. You can tap onto that future now. And this also works. So these are the certain advances and scopes of EFT. These are the further references. So the tappingsolution.com, if you go onto that website, they 2025 will also have, I think in September or May or September के बीच में कभी तो they will have their international conference, and keep an eye for that. You can subscribe for their email as well. So they will email you intermittently certain nice information about EFT. EFTuniverse.com, which is by I think Dawson Church, and they also provide training. The tapping app is an app for Android and iOS that can be useful. I have not explored it. And these two books, first is Emotional Technique for Dummies, and this is the Clinical EFT Handbook. So there are two volumes of it, 1 and 2, and very, very useful, both the books. The first book is very easy to understand and can be understood by any layperson. Second book is more for the clinicians, or someone who would want to explore EFT more. So this is, I hope this was helpful